was your last doctor's appointment? Do you know that most office visits are now scheduled for 15 minutes? So how can you get the most out of your doctor's appointment? Stay tuned. In this video, I will share 3 tips for your next office visit. If you're new to this channel, my name is Nikisha Kraft. I am a family nurse practitioner and a health coach, and I will share information with you that will hopefully inspire and motivate you to make changes in your life that will help to improve your health and help you to live a healthier and a happier life. So here we go. 3 tips. So the first tip is to show up to your doctor's appointment on time. Average for things that may cause a delay, any situation that may affect you arriving on time, such as childcare issue, a work meeting, traffic, whatever it may be. Average for those things so you can get there on time. And if you have double booked yourself or you find out you're not going to be able to make it on time, just call and reschedule, because doctor's office are usually flexible with you with that. They prefer you reschedule than showing up late or not showing up at all. And a lot of them will offer you an early morning appointment if you're more flexible in the morning, if your timing is more flexible in the morning, or they may offer you a late appointment after work, because most doctor's offices have at least one day per week where they open after 6 or until 6 p.m. The other thing is you want to arrive at least 15 minutes before your appointment time. And this is for pre-screening question. This is pertinent information that is routinely collected before you see the doctor. They want to know about your insurance, whether or not that has changed, if you have any new medication, new diagnosis, if you've seen any new doctors or specialists since your last office visit. Just keep in mind that time is money. Most doctors usually will have one eye on their patient and one eye on the clock, because this is how they get reimbursed as well. The more patients you see, the more productivity you're reaching and the more pay you'll get. So if you are 5 or 10 minutes late, your doctor might cancel your appointment. They might charge you a no-show or a late fee. And they might even say, yes, we'll fit you in, we'll see you. But what they're doing is they're double booking you with another patient. And this can affect the time spent with you doing the office visit, as well as the quality of care you receive. So arriving early will allow you to be room on time. And this will keep your doctor on schedule, which will give you the full 15 minutes or the maximum amount of time allotted to you, 50 minutes, so they can address any health concerns you may have. The second point is to keep your greetings and your chief complaints concise. You want to avoid sharing any information that may seem irrelevant or unrelated to your office visit. Try not to indulge or divulge in conversation that is not pertinent or is not directly related to your office visit, because this will take away from the time that your doctor has to spend really addressing the issues that are really concerning to you during that office visit. And this will take the doctor off track. Sometimes they can lose their concentration, and sometimes you might not actually get your answers because you spend time talking about things that were not actually related to what you're there for. You want to stick to the facts. You want to keep your questions and your answers short and concise. The third and final tip is that you want to bring at least 3 questions with you or concerns that you may want to be answered by the end of the office visit. You want to prioritize those questions or those health concerns based on the most concerning thing to the least concerning things, okay? And that is because your doctor has a lot to cover in 15 minutes, and that is outside of the questions or concerns you may have. And so you want to make sure you write them down so you don't forget, and also that you prioritize what it is you want to be addressed during that office visit. So if it's about your blood pressure, you want to have some blood pressure readings. You want to have some symptoms you may have and maybe some side effects from the medication. Same thing if it's your diabetes. You need to have some sugars, at least a month-long sugar. I usually request from my patient so I can see how your blood pressure has been doing. And if you've been having low or high blood sugars, write down the dates of when they happen. Are they in the morning or in the afternoon? And just any problem you may have some specifics about them and why you want them addressed during the office visit. You want to bring a list, because this will help to keep you and your doctor organized and on track, because remember, the time is money, and 15 minutes is not a lot of time, and so you want to make sure that you're using it wisely. So to recap, The 3 tips that you want to make sure you do when you go to your next doctor's appointment is you want to make sure you show up on time, and number 2, you want to make sure that you keep your greetings and your chief complaints concise and to the point. And then number 3, you want to make a list and bring with you to the doctor of the issues that you want them to address, and prioritize that list from the things that are most concerning to you to the things that are least concerning, so that you can get those issues addressed in a timely manner. I hope you found this video helpful the next time you visit your doctor. Don't forget to like and subscribe. Until next time, see you in the next video.